Why is the prevalence of heart disease still the #1 killer in the U.S.?
Well, it's really important to keep in mind that COVID, the virus itself, binds to a receptor called ACE2, and the most dense concentration of those are in the arteries in your body, the lining of the arteries, and therefore that explains a lot of the symptoms. Now, without the virus, and that virus has actually increased the level of heart attacks and strokes in people under the age of 50. Even some in their, single-digit kids have had strokes and heart attacks. But the general population, for the last 50 years, we've tried to reduce the rate of heart disease. But in 2015, we hit a level of prevalence, almost 42% in the United States, of cardiac disease. That was not expected until 2035. What that means is it's 15 years earlier and 20 years earlier even. And what that means is that we're very good at treating the disease after you get it, but we have done an abysmal job of trying to prevent the disease. So what we did is we developed a test called the PULS Cardiac Test, which detects the actual cause of coronary artery disease, which is the major cause of morbidity and mortality in cardiac diseases. And this pulse cardiac test measures 9 signals from the lining of your arteries when it's damaged, and it allows us to find the development of what's called atherosclerosis or coronary artery disease at a very early stage, allowing early intervention and prevention. Now, it turns out that since the COVID virus damages the lining of the arteries, the pulse cardiac test is very valuable to be able to assess how severe your reaction to the COVID virus is and whether you're at increased risk of having a heart attack or stroke from that. It can also be used to follow the disease course. Preferably what you would see is that during the actual disease, the pulse test will go up. We know that. We've seen it hundreds of times. But after it, if you're recovering well, it will go down. And if it stays persistently elevated, we know you've got ongoing inflammation, and we need to take some strategies to reduce that inflammation, which would be akin to preventing heart attacks and strokes in an uninfected population. We may put you on a statin. We may put you on a blood clot preventer like clopidogrel or aspirin. And there are lots of things that we can do that will make sure that you don't succumb to that.